It's extremely important, epigenetic dysregulation in CML, because it accounts for many of the features of drug resistance in CML. And also, when patients undergo transformation to blast crisis, it explains many of the hallmark gene expression changes and behavior of CML blast crisis cells. So for example, when patients undergo blast crisis transformation, they acquire epigenetic events that drive some of the hallmark features of blast crisis. So this includes increased stemness, decreased differentiation ability, increased survival, and also BCR-ABL independence, such that they become resistant to the standard drugs that are used in this disease. So what are the epigenetic features or molecular mechanisms that give rise to this? Well, they include activation of the PRC1 complex. And this is an epigenetic complexes that bind certain genes and suppress functions that, for example, include cell death, include differentiation ability. Another feature of the epigenetic progression is that of increased DNA methylation. And the DNA methylation that we observe in blast crisis CML is associated with many of the hallmark features I've just described. So silencing of genes involved in differentiation and also enhancements of stemness features. How does the DNA methylation occur? Well, the thing is, it's very similar across blast crisis samples, whether you have myeloid or lymphoid blast crisis. And what we found by examining samples from patients in chronic phase and also when they transform to blast crisis is that the sites of methylation in the genome are the regions exactly where another PRC complex binds, that is PRC2. So we discovered that where PRC2 binds in chronic phase, that is exactly where the methylation occurs in blast crisis. Now, the features I've described probably account for half of the blast crisis transcriptomic changes. And what we've also found is that they're very similar across majority of blast crisis sample, despite there being heterogeneous mutations across the same samples. The significance is the following. The first is that what it means is that you can inhibit these epigenetic programs by a combination of two drugs. One is PRC1 or BMI1 inhibitors with hypomethylating agents. So now when we treat blast crisis cells with these two epigenetic agents, we find that they dismantle the ability of these cells to survive in vitro and colony forming assays, and also their ability to serially replate, which is a readout for stemness ability. In addition, we find that the genes that are dysregulated by these two processes can be used as biomarkers for identifying patients in chronic phase who are at risk of developing drug resistance or transforming to blast crisis. So when we applied these signatures to look for similar events in chronic phase samples, we could see that the same genes which were downregulated in blast crisis were also similarly downregulated at the time of chronic phase. So what this means is that we have the potential to identify patients in chronic phase who are, so to speak, predestined to transform to blast crisis and potentially use the same combination of therapies to perhaps interdict their progression to blast crisis. So these are some of the features that tell us that epigenetic dysregulation in CML is quite important.